Assalamualaikum dear students, welcome to your channel the Anatomical. Today's class I am going to teach you the extensor retinaculum of the hand and the different muscle compartments, facial compartments which are formed by this extensor retinaculum. What are the structure which are passing deep to it and what are the attachments of the extensor retinaculum. So first I will highlight this. This is the extensor retinaculum of the wrist or the hand. I will highlight this and then I will add the bones to it to show you the attachment. So here you can see that this extensor retinaculum is attached to the medially. It is laterally attached to lower part of the anterior border of the radius over here. This is attached to the radius, it is lower part of the radius, and medially it is attached to the stylet process of the ulna, also the tripetral and the pisiform bone. So here is the attachment. When I will highlight, you can see the attachment over here. Now you can see this is the attachment of the lateral attachment and this one is the medial attachment to the lower part of the ulna, the pisiform bone and the triquetral bone. So this is the attachment of the muscle, the flex extensor retinaculum. Now I will show you the different compartments which are different muscles which are passing through it. So the different muscles which are passing through it, they are arranged in the form of the 6 compartments. From the first compartment you can see the 2 muscles are passing, and these 2 muscles are the abductor pollicis longus muscle and extensor pollicis brevis muscle. So these 2 muscles, these are passing through the first compartment, the facial tunnel, which is formed by the extensor retinaculum. The second compartment, through the second compartment again 2 muscle tendons are passing, and these 2 are the tendons are the extensor carpi radialis longus and extensor, just a minute, extensor carpi radialis brevis. So these 2 are the muscles which are passing through, these 2 are the tendons which are passing through the second compartment of it. Through the third compartment, the one muscle which is passing, the tendon of one muscle which is passing is extensor pollicis longus. This is the only muscle which is passing through the third compartment formed by the extensor retinaculum. While through the fourth compartment, lot of things are passing through it. So first you can see the 4 tendons of the extensor digitorum muscle. In addition to this, there is the tendon of the extensor indicis muscle. In addition to this, also the artery which is passing through it, just a minute. So here you can see the blood vessels which are passing through. These are this is the posterior interosseous artery and posterior interosseous nerve which is passing through it. Then we are having the to the fifth compartment, the tendon which is passing over here is the tendon of the extensor digiti minimi muscle, and through the 6th compartment, the tendon which is passing is extensor carpi ulnaris. So I will add first, I will show you highlight the extensor reticula, and then I will add different muscles. And now you can see through the different compartment. First compartment, 2 tendons, these are the tendon extensor pollicis brevis and the abductor pollicis longus. Then the 2 tendons, the extensor carpi radialis longus and brevis. Then third is the one, this is the extensor pollicis longus. Then through 4th you can see the 4th tendons of the extensor digitorum along with the tendon of the extensor indicis. Through 5th compartment passing is the extensor digiti minimi, and through 7th is the extensor carpi ulnaris. So this is the attachment of the extensor reticula, the 6 tunnels, the tendons which are passing through it, and also you can see over here in the dorsal aspect of the hand, you can see these are the dorsal interosseous muscle. These are the dorsal interosseous muscles which are present on dorsal aspect of the hand. On the palmar aspect, I have shown in the previous class the lumbricals and the palmar interosseous muscles. So on the dorsal aspect, the dorsal interosseous muscles are present. That's all about the today's class, and Allah Hafiz.